A motorbike rider has been involved in a serious collision with a car.
39-year-old T-boned by a car with a broken leg, dislocated shoulder and maybe a broken pelvis.
Dr. Meyer calls on emergency doctor Michael Dunn, who's just about to finish his shift.
Michael, there's a chopper coming.
Cool.
With a broken person. 39-year-old motor vehicle accident.
Cool. Where are they going?
I'm trying to figure that bit out. This will be free. He's going to go to theatre. It's bad for him, but good for you because you can take the space.
Cool.
I'm always worried when I hear it's a motorbike accident coming in because the injuries can be quite severe and oftentimes the patients tend to be in quite a severe amount of pain.
John was on his way to the shops when he collided with a car. He was wearing a helmet, but he wasn't wearing protective clothing.
Everyone ready? That 1, 2, 3.
Jonathan, 39-year-old motorcycle rider. He's been T-boned. He's been ejected over, landing predominantly left side. He's got grazes, period dislocation left shoulder. And significant is a mid-shaft femur. Very evident distortion and outward rotation.
Okay.
John, hi. I'm Michael, one of the doctors, okay? We're looking after you here.
Can I ring my mum?
I'll give her a call for you shortly, okay?
John's family, including his mum, all live in Tasmania. He's been travelling alone around Victoria.
Where's your pain at the moment? Stay still, stay still. Just tell me. Your shoulder? Yeah, okay.
Shoulder.
Yeah.
And
Your leg probably as well, is it? That's okay.
John's been given ketamine for his excruciating leg pain, but the powerful medication is making him slur his words and feel disorientated.
Big breath, John.
The fracture that John has is so bad that you know that the force that went through that was quite significant. It's going to be, I say, a very challenging fracture to actually fix.
Rhesus 5, I reckon. Cool. I think it's just been cleaned at the moment. Thank you.
Emergency Registrar Dr. Andrew Wallace is a proud Scot with a wee bit of an accent.
And did not realise that "we" was a Scottish word until I arrived here and was told by my Australian co-workers and friends. I just presumed the whole world said "we." It's good to see who's going to be about for Rhesus 5. I think my biggest fear about the TV crew being about was if it did get filmed that they would dub over me. And some of my co-workers who maybe haven't been exposed to Scottish people said that would happen because they can't understand me.
But Dr. Andrew has made a new life down under with his fiancée Caitlin, also from Scotland, and their fair dinkum mate.
I'm on the way to becoming a true blue Aussie. I'm waiting for my citizenship to come through. I'd often tell Dobby about my day, more than I'll tell Caitlin, because Caitlin's quite squeamish and doesn't want to hear any of my emergency stories, but Dobby's always a good listener in that respect. You know, gonna just have a ball. Right.
Back in the ED, Dr. Andrew gets down to business with an 18-year-old footy player injured in a tackle during her local match.
We're going to be moving you over onto that bed.
Yeah.
I've already done this, but want you to do nothing.
Yeah.
We want to do all the work.
Caitlin's wearing a neck brace with the possibility she's injured her spine in a crushing tackle.
And neck injuries in the spine can be absolutely catastrophic and cause paralysis.
Go, ready, set, go.
Caitlin's high heart rate at the moment is worrying us. It could be just anxiety. It's a stressful situation. She could be bleeding internally, so we've got to make sure that we rule out more serious causes.
Hi Caitlin, my name's Rain. I'm one of the trauma doctors. I'm just going to have a look at you while the other guys talk to you, okay? Do you remember where you got tackled? From the back or the side? All platinum, real. Yeah. And you remembered every number, so you weren't sure exactly what happened?
Yeah.
So you were able to get up?
I got up.
And you stood on your feet?
Yeah.
She said where she got tackled felt like bra strap level, but the pain is lower down.
She's tender, and especially the lower part of her back. That worries us because it gives us more indication that she could have injured her back. I think would include a fracture to the spine.
Just keep it there, keep it there. Can you keep it in the air? it up. Would try this one? Is it because of the pain? Yeah.
Still worried about Caitlin's neck and spine, the team puts a more protective brace on.
Putting myself in her shoes, I'd be worried. You know, it's an intimidating environment in the emergency department. You know, you don't have your loved one or your mum at this point, and you're worried that something's seriously wrong with your back. I think people often say that being in emergency is the worst day of their lives, and I think it's always important for us to remember that.
Okay. Great.
Hopefully, Caitlin won't be without her mum for long. She's on her way in. With Dr. Andrew now worried, Caitlin may have other injuries.
Can you swallow for me, darling?
Was the tackle worse than we thought, and has she injured kind of the big major organs in her abdomen, her liver, her spleen, the injuries that are more susceptible to injury from a blunt force trauma?
He's got significant abrasions to his right hand and wrist and to his left shoulder. Appears to be clinically, though, unlocated at this point in time.
Back in Resus 6, motorbike rider John has smashed his shoulder and leg after colliding with a car. Far from his home in Tasmania, John is all alone.
I'm not home.
The 39-year-old's femur, or thigh bone, is being supported by a splint to keep it still. It's the longest and heaviest bone in the body, and John has snapped it in two.
Can you wiggle your toes for me, John? Wiggle your toes. Good. He's got good pedal pulses and movement in his left foot.
We check to make sure he can wiggle his toes, that he has sensation there, and that he has a good pulse to his foot. Whenever you have a fracture to an arm or a leg, there's always a risk of nerve damage, depending on where the actual break is and how severe it is.
Okay, X-ray.
It's just in focus.
Yes, please, yeah. And shoot through the left femur as well, if that's okay.
John is a long way from his family. His life is unravelling, and he has no one to turn to.
He's got femur broken in two spots, so free-flowing fragment there.
Quite surprised at how bad that fracture is. It's broken in two different places, and fractures like this means that this bad, there is always the risk that he may lose the ability to walk normally again.
It's starting to dawn on John just how badly injured he is.
Please help me. Please, God, help me.
Have you needed an operation in the past for your back?
No.
No, good.
In Resus Bay 5, teenager Caitlin is unable to move after a massive tackle during a footy match.
We're just gonna roll you onto your side. You don't have to do anything.
Okay.
Let us do all the work.
Dr. Andrew and the team are worried she's severely injured her back.
1, 2, 3.
Is that sore there?
No. It's a little tender there.
Yeah.
Yeah, it's a bit tender.
Yep.
And there.
Yep.
Yep. Yeah.
Dr. Andrew is also concerned about any damage to the 18-year-old's neck. And until she gets a CT scan, they're keeping her immobilised in a brace.
So just try and keep your head still.
Yeah.
If you start feeling sick, or you're gonna vomit or anything,
Yeah.
just literally just shout out at us.
Okay.
Okay? Don't worry.
Dr. Andrew is also keeping a close eye on Caitlin's unusually high heart rate.
Do you know if your heart rate's always been a bit fast?
Yeah, it has. Sometimes when it's resting, 115.
Okay.
And when I do sports, it gets up to 200.
Sure.
And I've seen cardiologists.
Okay, good.
They said it's normal.
Okay.
For me, anyway.
Yeah, yeah.
It's not particularly usual for 18-year-olds to have kind of a baseline elevated heart rate, but it's not unheard of. It still doesn't completely reassure us. We can't just ignore the other potentials for a raised heart rate.
As Caitlin is prepped for CT, her mum is on her way to be with her.
Next thing we're going to do is we're going to scan your spine. This will look for things like fractures or anything like that. The worst part probably for you is just going to have to be staying flat until we've done the scans.
Probably can't go to the toilet.
We can pop you on a pan.
Yeah.
Oh, okay.
So we roll you like we did before.
Yeah.
We'll slip a pan under you, and then we'll tilt the bed, and you just wee lying down.
I think in terms of bedpans, I don't know if I would like to do it. I think younger people have got a big aversion to bedpans. Maybe the older generations are more comfortable with them.
I think I might wait for a toilet.
Okay, no worries. If it gets too bad, let us know. We can try.
Not taking any performance-enhancing stimulants to give you an edge in the game.
No.
But one day someone will say yes to that.
The teenager is yet to learn how bad her injuries are and whether she'll get up and walk again.
So I think that's the main concern. Caitlin's in a lot of pain. She's saying she can't really feel her leg properly. Has she broken her back? Has she injured her spine? It's a life-changing injury.
Doctor's charted some pain relief as well, so we'll get that sorted when you get back. No worries.
My leg is still.
I know. Stay still for me, man. Stay still for me.
In Resus Base 6, 39-year-old motorbike rider John has serious injuries after colliding with a car.
John's got a pretty nasty injury to his left shoulder, where he's broken the head of the shoulder bone, and he's also got a terrible fracture of his femur, which is a bone in your thigh on the left-hand side.
Okay, mate. I'm gonna get you to hold yourself here. It's okay. It's okay.
Something's wrong with that shoulder.
You hold that. You hold it there in the same position. Okay. You hold it and keep it there. Okay.
Dr. Michael also needs to rule out spinal injuries, with John being thrown off his bike.
It's important to identify if there's any major deformity or problems in his spine or back that we can't see with him lying on the bed.
Okay, any medical problem for your doctor for?
John's been travelling on his own, but this is not the time to be without loved ones.
Will I go and die?
No.
I can't die?
You're not. You'll be fine.
Sweet.
Sore your ankle? No.
Seeing the fracture that John has is so bad that you know that the force that went through that was quite significant, and we need to exclude any further serious internal injuries that we can see or examine in the ED.
So I passed my knee.
Yeah. Okay. Fine.
Just passed my knee.
As John is prepped for CT before he goes to theatre, the worry is he may not regain full use of his badly broken leg.
With a fracture this bad, there's always risk of nerve injury, injury to blood vessels, and potentially not being able to rehab to the point where you can walk properly again.
Can we go to X-ray?
While doctors and nurses in the emergency department are treating patients, there's an army of workers like Gina Talaveski making sure everything runs smoothly.
I love being helpful. I love doing that little bit extra for everybody across the board. I just enjoy keeping busy.
Gina is an emergency and trauma assistant, doing everything and anything that's needed.
Just basically making sure everything's clean like you do at home.
This is Gina's 15th year in the ED, and it's taught her a lot.
By being kind and showing respect, you get a lot in return. I'm pretty sure you may have X-rays as well, my dear.
But it's her big heart, helping patients in their time of need, that has earned her her nickname.
Do you want another blanket? I'm called Mama Bear. I'm actually known as Mama G or Mama Bear in the department because I take everyone under my wings. Hello.
So I haven't seen you. Have I met you before?
Yes, I helped you come from the helipad.
This time Gina's needed in Resus 6 to help calm motorbike rider John, who's a long way from family support after severely breaking his leg.
I feel I need someone to...
Oh, it's all right.
I've got no one. I've got no one.
Would you like to hold my hand?
What about Gina? Gina's fantastic.
I've got
There
no
we
one.
go. It's nice to have someone there to hold his hand, to reassure him and let him know that he's in good hands.
It's Michael here in ED.
Dr. Michael organises to get him to CT so they can fully assess John's injuries.
Just so you're aware that there's a guy who's been T-boned on a motorbike who's got a femoral fracture, broken in 2 distinct places.
After a marathon shift, Dr. Michael heads home, with highly specialised trauma nurse Eliza Burke now looking after John.
Okay, we're going to go and do some CT scans, all right?
The way John is behaving is not unexpected. His body is half broken. One side of his body, all the skin has been torn off. This guy is not only in agony, he's anxious.
John, what we're going to do now, I'm going to be your chauffeur.
I just need to talk to someone.
That's his detail. I've managed to push in the trolley and hold in the hand down pat. So I'll keep holding his hand.
Okay, very slowly, everyone. Ready? 1, 2, 3. There you are. Done. Okay?
John, we're about to start the scan, okay? Just stay nice and still for me.
The team needs to rule out any injuries that may endanger John's life, but he remains agitated in the CT.
John, just keep your arm down for me.
Yeah, my leg needs to
Hang on.
John is starting to be sick. They have to move quickly to stop him choking on his vomit.
Okay, hang on. Okay, ready? 1, 2, 3.
Dr. Meyer is called immediately.
You guys okay?
Oh, gosh.
The vomit?
I feel like he's not agreeing with you.
Yeah, okay.
All right, it's
You're
okay.
all right, you're all right.
Got lots of pain.
Hey, it's okay.
okay.
Just having a little panic attack. Okay, it's just it's a little panic attack.
Oh, no.
All right.
John. No. You're not going to choke. I've got your airway is perfectly fine, okay? It's all right.
I'm okay.
You're all right, mate. You're okay.
Thank you.
It's okay.
Thank you.
Okay, take 2.
With John's panic attack under control, the scans can begin.
No talking, John. Keep still.
John has a very badly broken shoulder, the top of the arm bone on the left. He has a very badly broken thigh bone, the femur on the left, but his internal organs and his brain and spine are intact.
He's now off to theatre to fix his broken bones, with Gina holding his hand all the way.
John, do me a favour, honey. Just relax.
ETA is when?
About 15 or so.
15 minutes. And do you know where you're doing it or not?
Trauma 1.
All right.
Senior emergency Dr. Martin Dutch decided to switch to medicine after starting a science degree.
Suddenly realised that people were far more interesting than little white mice to interact with, and so decided to study medicine.
Somehow, he also manages to find the time to be one of Victoria's top first aid volunteers.
I'm fortunate that I'm in a leadership position as a volunteer delivering medical care to the community, and I'm the State Medical Officer of St John Ambulance in Victoria. That's something I'm proud to say as part of my skill set, that I can get things done when we need to get things done.
Dr. Martin's extensive experience is needed now.
Warm up and receiving.
With the arrival of a trauma patient with airway injuries.
Got a 37-year-old male, possibly an MVA, down to Williamstown. He had a head strike in the windscreen and a swelling around his airway. This is an airway risk.
Thanks, Micah 19. Warm up and received.
Martin?
Yeah.
Dr. Martin gets ready for the patient, whose life is in danger. Matthew had just dropped off his 2 children to school minutes before the accident happened.
What we're going to do is get you across to our bed first, okay?
Registrar Dr. Caitlin Young is among those helping Dr. Martin.
Okay, on go. Ready, set, go. And down and go. Ready, set, go. Well done, mate.
So got a 37-year-old male, sole occupant driver of a car in a suburban street. Looks like he's come around the corner. He's hit a parked car. Looks like primarily most of the impact has been on his head.
You've got lots of blood in your mouth there, haven't you?
Matthew slammed into the windscreen of his vehicle.
We're worried about his breathing. There's blood in his mouth, and that can cause swelling with these injuries. If that bleeding or the swelling goes into his actual airway, it can make it very difficult for him to breathe, and that sort of situation can develop quite quickly.
The team is worried about Matthew's breathing, but there's another serious problem. His blood pressure is heading south.
A little sharp pricking area.
To treat Matthew's falling blood pressure, Dr. Caitlin has to set up an intravenous line to get blood into him fast.
Can you feel a radial pulse?
Matthew's blood pressure is low, and that means that all of his veins have collapsed. We've got really big problems. The amount of blood flowing to these organs is dangerously reduced.
Can I have a look?
Matthew needs blood urgently.
We absolutely need to get this line in as soon as possible. The situation that Matt's in at the moment is absolutely life-threatening. He's in shock.
At the Royal Melbourne Emergency Department, Matthew's critically unwell after slamming his head into the windscreen of his car in an accident.
All right, and you got to put one of those in, yeah?
The father of two's blood pressure is dropping and his body is shutting down. Dr. Martin can't get an intravenous line into Matthew's collapsing veins to give him life-saving blood.
All right, he is to shut down. You want to grab the ultrasound?
Yeah.
We use the ultrasound to help guide the needle that we're popping into the vein, and it also means that we can access deeper veins than what we can easily see on the surface of his skin.
Line's in.
Thank you.
So now that we're giving Matt blood, I'm hoping that his heart rate will slow down, his blood pressure will come up. If he doesn't do that, what that says to me is that we can't replace his blood at the rate he's losing it. And that's truly a life-threatening situation.
The current blood pressure, 92/70.
But Matthew's vital signs are not improving. A third unit of blood is given, but it's not enough to compensate for what the team suspects is internal bleeding.
He's pretty tachycardic and hypotensive, so he's had 3 units of blood now.
Tachycardia means that the heart is beating very fast because it's trying to compensate, it's trying to bring up the amount of blood that is circulating around the body. So we're worried that he's bleeding internally and we need to find where that blood is coming from.
Dr. Martin uses the ultrasound again to try and locate the source of internal bleeding.
There's a bit of free fluid. It's not around the spleen, it's not up near the liver.
Right now, Matt's really unwell, and we just need to work out where the bleeding is.
Big breath, mate. Oh. Oh, wow. That's unusual.
The bottom half of his breastbone has a big dip in it. You can see his lungs on either side, but it's making it hard to get a good view of his heart. So it's possible that fluid may be building up around the outside. That's a life-threatening condition.
Dr. Martin makes a difficult decision to move Matthew to CT immediately.
I'm good to move. You got some blood?
Yes.
So right now, Matt's got a number of important issues that we need to address. He's showing evidence that he's bleeding internally somewhere, and his airway still remains at risk. There's always a danger that he'll get worse on the way to CT, but he's not going to get any better staying where he is, so we need to press on.
My name's Andrew. I'm one of the emergency registrars.
Emergency Registrar Dr. Andrew is getting medical background on injured footy player Caitlin. who's being scanned for possible crippling back injury after being tackled.
She's known to orthopaedics.
Caitlin sees an orthopaedic specialist at the hospital, and Dr. Andrew now knows she has a pre-existing injury to her back.
Great, thank you so much. She's got one of the bones in her spine has slipped onto the one below it, which causes her ongoing pain, and they're working her up to see whether they're going to operate on it at a future date.
Hi, I just called you. Oh no.
Caitlin's mum, Jade, has arrived just in time to hear if her daughter's pre-existing back condition has been affected.
Distinct pay. You still haven't? Because I can't go until they get the clearance.
The CT results are in.
Oh, we've got the chronic old changes, but we've got no new breaks in the bone, which was the thing that we were worried about.
Dr. Andrew now believes Caitlin suffered spinal shock.
Spinal shock is when the spinal cord takes a hit, so it takes some damage, and it causes changes in your nerve function. It's usually temporary.
Which means he has some good news for Caitlin and Jade.
Hello, me again.
Hi.
Good, so spoken to the orthopaedic doctors. They're happy with how everything sounds, happy to see how we are on our feet. Should we have a go? You just...
I need to pee.
Yes, you do need to pee.
She can wee!
For the first time since her tackle, Caitlin is up on her feet again.
Follow Panadol line flat. You can help them wait for hours.
As relieved as Jade is about her daughter's recovery, she's not so happy about her playing footy.
I'm not keen for her to get back to playing football just yet.
Yeah, I prefer it to be swimming.
Yeah.
Or Pilates or anything not throwing herself at it. She's smart. She'll know in an ideal world she wouldn't be playing football.
Yeah.
It's rubbish that at 18 she's having to think about her back in 20 years' time.
Yeah.
How was that?
Good.
Best pee ever?
Yes.
Good. Caitlin's got to accept there's a bit more danger to her playing footy. She could make this worse. I guess, you know, if she loves it, she's got to do it.
All good, John.
Definitely happy to see Caitlin getting out of the hospital in one piece and back to care of her mum. And I'm sure there's going to be some terse words at dinner about the ongoing footy career.
In the ambulance bay, paramedics are arriving with a 76-year-old man who has extremely itchy skin.
He looks really itchy. I don't know anything about him yet. Perfect. We can learn together.
Emergency Dr. Michelle Thornhill and nurse Abby Fistrovic are not sure yet what to make of Ray's symptoms.
He is obviously distressed by this itch, and as I am talking to him, I'm noticing that he is very focused on the scratch, that he just can't stop.
Hello, sir. What's his name?
Raymond.
Hello.
Ray.
Nice to meet you, mate. I'm Abby. I'm one of the nurses. This is Michelle, the doctor.
Oh, dear. We gotta do something about this itching. It's driving you nuts. Oh, man. Okay. It could be a number of things, anything from an allergic reaction or some underlying illness, and that might be causing a rash. On 3. 1, 2, 3. Oh.
Ray's wife of 51 years, Chris, was so worried about him, she called an ambulance.
So today, Ray has woken up and been very confused and lethargic, can't answer open-ended questions, and can't really obey commands unless they're very, very short, easy commands.
Ray's heart is also beating fast and his temperature is up.
So it's just a marker of unwellness, but it's hard to tell initially what's going on and what the cause is. When was it you really started to go downhill? Was that yesterday?
Hard to see.
Dr. Michelle finds out Ray's recently had an operation.
He unfortunately had a skin cancer on his scalp, and he had plastic surgery recently to remove that cancer and the tissue around.
A skin graft was taken from Ray's leg to replace the skin on his head.
So it's mainly your itching, your sort of aches all over, and then you had this graft a few days ago. All right. I'm starting to put a picture together in my mind, and the first thing I'm really concerned about is infection.
Based on Ray's rapid heart rate and the temperature he's running, Dr. Michelle believes he has a sepsis infection.
When we say sepsis, we usually mean that there is an infection that has spread into the bloodstream.
Doing your temperature while you do that?
Is your head sore here where they put the graft on?
The graft on and the graft's moved.
Okay. I'm really concerned for Raymond. Sepsis can be life-threatening. So it's really important to work hard and fast to treat him with the strongest antibiotics that we can.
I'll be setting up to do a surgical airway if we need to.
At the Royal Melbourne Hospital, Matthew is being prepared to go to CT.
Step backwards for 2 seconds. It's all right, done. I'd sort of make my own kit. I'm good to move. You got some blood?
Yes.
The father of two hit the windscreen of his car in an accident, breaking his jaw and causing swelling of his airways.
We really don't want him flat, just as long as we've got some head up. It's like a wedge.
Yeah.
Our job in emergency really is to prepare for the worst case scenario, and that's constantly what we are planning for.
If Matt becomes less responsive, he could stop being able to control his airway. And if we can't get a breathing tube in the top end, someone's going to need to cut a hole in the front of his neck. So that's all I need.
Yeah.
Dr. Martin is ready to save Matthew's life if things go wrong while he's being scanned.
You just call me in if you want me to use any of this stuff. I've got in my hand our get out of jail card. A scalpel, a special guiding tube and the breathing tube to perform a surgical airway. We can do that within seconds. And it's important that we do it within seconds because if Matt loses control of his airway, seconds are all that we have.
The marketing manager has two things threatening his life: possible airway collapse and dangerously low blood pressure with no improvement after 3 units of blood.
Whilst Matthew's in the scanner, we're continuing to give him his blood transfusion and monitor him very closely in case that changes at any time.
Are they taking more pictures, are they?
Yeah.
The CT imaging is taking longer than usual because of all Matt's injuries.
Going to be a little bit.
Dr. Martin stays close, ready to rush in and use his life-saving kit.
We're on standby if we need to do it urgently.
Across the corridor, retired air traffic controller Ray came into the Royal Melbourne Emergency Department very itchy.
37.9, I heard you say. I was
37.9,
just going to ask you. Okay, so it's probably on its way down after he had some Panadol and some fentanyl.
Along with itchiness, Ray has a rapid heart rate and a high temperature. Dr. Michelle believes he has an infection which has entered his bloodstream and can be life-threatening.
But this itching for you is sort of normal?
Yeah.
Yes. Okay, so it's not new that you're this itchy, correct?
Correct.
Okay.
But Ray's itchiness still has Dr. Michelle baffled.
I was trying to figure out what was causing this itching, and then we get more medical history, which gives us a vital clue.
Dr. Michelle and Abby go online to figure out what Ray has.
Here we go. Sézary syndrome. We hear that Ray has Sézary syndrome, which I've never heard of before. We were both quite baffled. Cuteness T-cell lymphoma. Certain white blood cells called T-cell become cancerous, affecting the skin. Never heard of it.
No.
No.
Okay.
Interesting. Okay.
So, Sézary syndrome is a rare form of cancer. It affects a certain type of the white cells in the blood and manifests as a primarily skin condition where people can have rash all over the body, presents as being very itchy a lot of the times, and they can develop multiple forms of cancer of the skin as well. Just gonna have a look over here. Sézary syndrome does explain the itchiness and redness of his skin. And also part of the treatment is long-term steroids, which puts Ray at increased risk of infections because it can weaken the immune system. So it does help to explain why he has this infection happening now.
Ray's been given antibiotics while the recent skin graft to remove a melanoma on his head is washed and bandaged by Nurse Gunnar.
So how long since you retired?
20 years now.
20 years?
Yeah.
All right.
Just where the infection is coming from remains a mystery, but the graft has not been ruled out.
He needs x-rays and scans to see where the possible infection might be.
This is absolutely a life-threatening emergency.
It's a tense time for Dr. Martin as he waits for his patient Matt to be finished in the scanner before he can get him to theatre.
I'm going to get one of the nurses to go up and set up theatre.
Matthew makes it through the CT, still breathing on his own, but is nowhere near out of the woods yet.
Jaw fracture.
Yeah.
That's all okay. Split a lot from his forehead.
Matthew's got a number of different injuries going on. Probably the major cause of his shock is that he's got bleeding inside his abdomen.
His airway is actually not compromised, which is really good. So they should be able to intubate him upstairs.
Matthew's airway could still collapse at any time. Dr. Martin's kit is his lifeline while he's being moved.
He's going to go to theatre. You're one of the anaesthetists. I've just been standing by in case we wanted to cut a hole in this guy's neck. Did you want that in the lift with you? Or?
Yeah, I'll carry that with me.
Right.
Thank you.
No worries at all.
In the emergency department, Ray is waiting for next steps after having the wound on his head dressed and bandaged.
How are you feeling now?
Oh, apart from death, I'll leave it as is.
After being made comfortable and with his wound dressed, there was only one person he wanted to talk to.
I'm hoping to eventually see Chris, and I've been married with her now for 51 years, and boy, do I love that girl. That's me 3 little chihuahuas barking.
Oh dear, how are you?
No, all right.
I spoke to the doctors, I spoke to the specialist.
You know more about it than me then, if that's the case. Give me a report.
Well, she said that she's not too sure where the infection's coming from. You've got to be so careful, Ray, with the infections. You've got a lot of good nurses and doctors around you there, Ray.
No, that's
darling,
good.
you're sounding so much better. You made my night now.
No, that's good.
It is amazing that, you know, some people just have it really hard. He's had a lot to deal with this condition, and it's amazing that he can still put a brave face on and still crack a smile and even make a joke.
Ray is now being transferred to a cancer centre to treat the blood infection and monitor his ongoing condition.
After Ray got admitted to the cancer centre, he's had a really long course of multiple admissions, multiple further infections. He has in fact passed away from his disease.
Go
Jonathan, 39-year-old motorcycle rider. He's been T-boned.
Something's wrong with that shoulder.
You hold that.
Dr. Michael's patient, John, suffered multiple breaks to his shoulder and leg when the motorbike he was on was hit by a four-wheel drive.
I feel I need someone close.
Oh, it's all right.
I've got no one. I've got no one.
Far from his family in Tasmania, John struggled with feelings of anxiety and isolation, as well as the pain of his injuries.
Hey,
All right, John.
It's just a little panic attack.
Oh, no.
It's all right.
Scans confirmed the seriousness of his injuries, and he went straight to surgery.
Please help me.
John's still in hospital, recovering after many surgeries.
My back's fractured in 3 places. I've got a rod in my leg and I've got a plate in my shoulder.
Throughout the terrible experience, he felt something was watching over him.
I lost my mum's necklace, which is very sentimental. She gave it to me to keep me safe. So I'm still here, so it worked.
He can't wait to get back on the road again. And there's only one destination on his mind.
Anywhere in Tasmania, somewhere close to my family. In the bush somewhere near a river.
18-year-old Caitlin went down hard from a tackle in a footy game and arrived at the Royal Melbourne in severe pain.
Ready, set, go.
Dr. Andrew was concerned she had spinal damage and that her passion for footy could lead to serious lifelong consequences.
We're going to scan your spine.
Yeah. Scans cleared Caitlin of a spinal injury.
She's known to orthopaedics.
But medical records showed Dr. Andrew that she already had a degenerative back condition.
Solid Panadol line.
But Caitlin may need to consider a future without contact sports. Father of 2, Matt, arrived with shocking injuries after his head hit the windscreen in a car accident.
You've got lots of blood in your mouth there, haven't you?
Dr. Martin and Dr. Caitlin feared Matt could suffocate from damage to his airway or die from internal bleeding.
Can you feel a radial pulse?
With multiple injuries, Matt was rushed to surgery. 14 weeks later, Matt is happy to be home after surgery for head injuries, a broken spine, dislocated shoulder and a shattered jaw.
The team at Royal Melbourne, they certainly were there when I needed them and they saved my life. I just remember waking up 7 days after the accident and not really knowing why I was there or what had happened to me, so that was quite intense.
Matt has a strong incentive to continue working hard at his recovery.
I just want to be a dad again and being able to spend quality time with my kids. So yeah, I feel incredibly grateful.